or if you'd like to raise your hand, we will do it that way. So I'm going to turn my video off, and then Matt, if you would like to, Sarah, if you'll turn your camera off for now, and then we'll have Matt go.
Thank you, Kim. Good afternoon, everyone. My name is Matt Kaufman, Deputy Director here for the Health Department in Contra Costa County. So I just want to first make just a brief acknowledgement statement of saying that we definitely empathize with all the residents in Crockett who have been enduring this situation for more than almost 6 weeks now. And we're aware of it. We are tracking it from the health department's perspective and assessing sort of the health concerns that the residents have there in Crockett. As of today, we do continue to detect higher than usual levels of hydrogen sulfide in the air. And just a brief summary, we issued a health advisory back on Friday, October 7th, after the air district, the Bay Area Air Quality Management District, recorded a 1-hour average reading of 0.036 parts per million. And our trigger level is the Office of Environmental Health Hazard Assessment acute reference exposure level of 0.03 parts per million of hydrogen sulfide. And so we did get a level that exceeded that midday on Friday the 7th and acted quickly to issue a health advisory for the town of Crockett for hydrogen sulfide exposures. Over the last weekend and into this week, we have been monitoring the community every day for hydrogen sulfide levels. On Tuesday, class resumed at the high school and the middle school in town. And so we began performing hourly averages to sort of get a sense of what our community was being exposed to in Crockett. Those numbers today, we're happy to report that there is 0 parts per million being measured at John Swett High School. We did get a measurement of 0.007 parts per million at at the Carquinez Middle School, which is located right up the street from John Swett High School. So we are still seeing hydrogen sulfide in the community above levels that we would expect. We're continuing to monitor, and we're going to continue to monitor the community as long as the health advisory is in effect, and that includes over this weekend. We do recognize that not all parts of Crockett are affected the same way, primarily due to concentration. The concentrations are higher of hydrogen sulfide closer to the facility. So the closer you are to the facility, generally we are getting higher readings there. We also are seeing higher concentrations of hydrogen sulfide during the warmer parts of the day, primarily between the 11 a.m. hour and the 2 to 3 p.m. hour. Hydrogen sulfide is a chemical that smells similar to rotten eggs. But the one thing about hydrogen sulfide that we just want to make sure everyone is aware of is that it does have a fairly low, what we call an odor threshold. So the level that you can smell it is much lower than the action level of 0.03 parts per million. In fact, the odor threshold is 0.008 parts per million. So fairly low. So there are times where you may smell hydrogen sulfide, or our community members may smell hydrogen sulfide, that rotten egg odor, but that doesn't necessarily mean that they're being exposed to levels that we would consider a public health concern. Since we issued the health advisory, we've been working closely with the community to respond, and that includes monitoring throughout the community. But we've also issued over 40 air filters to both the high school and the middle school to put into classrooms, corridors that are inside, gymnasiums, those sorts of areas, to make sure that the children that are attending school aren't experiencing the odors that may be present outside. We've also deployed air filtration devices to the Crockett Library because we did get some concerns from patrons and actually staff that were working at the library, so we've also done that. Ever since we issued the health advisory last Friday, we've had daily communication with our regulatory partners, primarily the Bay Area Air Quality Management District and the San Francisco Regional Water Quality Control Board. But we've also been talking daily and have a situation status meeting with the operator, CNH Sugar, as well as the Crockett Community Services District to get an update of where things stand in terms of their operation there. We do continue to, as I said, monitor the air. We're providing daily updates throughout the week of the air monitoring data, and we will commit to doing so until the health advisory is lifted. Now I'd like to turn it over to Dr. Sarah Levin to provide an update from the health perspective.
Thanks, Matt. And thank you all for making it today. My name is Dr. Sarah Levin. I'm a Deputy Health Officer at Contra Costa Health and have been working with our team here since we issued the health advisory. And I just first want to echo Matt's expression of our empathy and concern for the Crockett community who have been experiencing this for close to 6 weeks in their small community that is really trying to do its best to take care of itself. And we hope that we at the health department can help support you with the information you need to best care for yourself during this situation and do what we can to help it resolve as quickly as possible. So I just wanted to speak to the health effects that many are concerned about due to the ongoing levels of hydrogen sulfide in the air. You know, health effects with a gas like this is really determined by the dose, how much it is, which is why we're using the measurements as a way to guide our advisory. So the dose and then the duration, how long you're exposed to it. And with the levels that we're measuring based on the best standards that we have, that's what led to us issuing the health advisory with the warning that the symptoms you may experience at those levels we are measuring are the effects, the respiratory and the nervous system effects of that exposure to hydrogen sulfide. So that includes headaches, nausea, irritation to the eyes, the nose, the throat, and at present, the minimum risk level that goes from more of an acute to a chronic would be more than a 15-day exposure at 0.02 parts per million. We're using 0.03 right now as our acute level. We have not measured for that. We're longer than that 14-day exposure. But if we continue to measure levels that prolong past that time frame, we will be updating our health advisory as such. At present, the levels that we're measuring are 10 times less than what would cause us to issue more further warnings and take further action in terms of our health concern for a emergent public health risk. The chronic duration of these levels will determine sort of what the potential long-term health effects are. But we, as Matt explained, are really anticipating that this situation will be resolved by the operators and expect that we should hear a timeline at some point. The other thing that we really want people to know is that the only thing that really is able to clear the hydrogen sulfide from the air is activated charcoal filters, of which, as Matt explained, we have distributed to the schools and the library system. CNH has notified that they are distributing to any member of the community, so please contact them for air filters that are appropriate to reduce your exposure level indoors to hydrogen sulfide. And masks are not effective in protecting you from inhalation of hydrogen sulfide. I think I'll stop there and take questions.
Great. So thank you, Dr. Levin, and thank you, Matt, for that really great overview. So before we start taking questions and answers, and answering your questions, I just want to be clear that we'll be answering questions today that are related to the health impacts of this situation. We don't regulate the water treatment process that's happening at the CNH plant right now that's causing this issue. So we're not able to speak to that directly. We're also working in partnership with the Bay Area Air Quality Management District on some of the monitoring that's going on out there. So we can answer questions to the work that we've done, but we'll refer questions to the appropriate other agencies as necessary and as makes sense. And all of that information, their contact information, is in the latest health advisory that we put out around noon. So with that, again, 2 ways to ask your questions. If you want to drop them in the Q&A or if you want to raise your hand. I see I have a couple of hands up. So we will start with Sarah. I'm going to allow you to speak, and then if you will unmute.
Yeah, I have.
Thank you.
Okay, this is Sarah Donchi. I'm with KPIX5, CBS News Bay Area. A health-related question. You know, I've spent the day out in Crockett, and I spoke with people who say that they have certain sensitivities, asthma and whatnot. And I know you guys use data to measure what the expected effects are over a certain period of time. But I've already, in the short time I've been here, talked to a number of people who say they believe that they've actually gotten sick or had adverse effects from spending too much time outside, breathing the stuff in, to the point where some said they have to miss work. I just want to see if you can speak a little bit to the frustrations of these people who say, yes, we know what the numbers are, but I personally have not felt well in the time I've been outside during this event. Thank you.
Dr. Levin, do you want to come back on and address that?
Sure. Thank you for that question, Sarah. Matt and I were actually at the town hall last night and heard very similar concerns from the community. I do want to be clear that our role in this is really looking at it from a public health perspective. So we need to use these standards of measurement to really be able to give the best information with the knowledge that we have. That being said, that information is coming from large cohorts of looking at impact on population level. Individuals who have certain sensitivities may be experiencing more extreme symptoms at lower levels. There is variability and within the human response to what the dose and the exposure duration is in terms of when they may have symptomatic effects. What we do know is the main targets of hydrogen sulfur toxicity are the respiratory system and the nervous system, and it crosses the blood-brain barrier very much. So I would, as I suggested last night, really recommend that people seek care with their healthcare providers if they are experiencing symptoms as they perceive to be related to the hydrogen sulfide or obviously to any other health concern. But our role in this aspect is really as the public health department. And so it's difficult to make a prediction on the range of impact it would have on given individuals, given their unique health conditions and situation.
Sarah, did you have a quick follow-up?
Yeah, I suppose, my follow-up question would be this. I mean, we've talked to a number of people now who I suppose, and I know that you can't talk about it from the operations standpoint, who feel very frustrated because they sort of just feel that this is not something that they should have to deal with. But they also are kind of wondering when this will end. And I know you want to focus on the health impacts, but that's an immediate question that we wanted to try to get answered from somebody at the county.
So I actually think that CNH Sugar has a plan on how they're addressing this, and so we really would recommend that you call them for the specifics on that. Again, we don't have any role in how they're addressing it. We're simply looking at the effects of it on the community. So again, CNH's number is in the advisory, and I'll also ask somebody on my staff to drop that into the chat. So So I appreciate you understanding that that's not something that we can speak in detail to. And so, so really appreciate you reaching out to CNH for that. I think Kelly, you are the next one to put your hand up. So let me let you go. Okay. All right, Kelly, we should be able to hear you. Kelly Roman?
Yeah, this is Tom. This is Tom Bakar. I'm her reporter.
Great, Tom. Go ahead.
My question is a really very simple one because it's very confusing. The doctor said that after 14 days, there's an issue with exposure. This has been going on for 42 days and looks like it'll go for another 10 to 12 days. How can you square those two things? Because at these extreme low levels, the body's supposed to be able to take care of this. But if you're saying that at 0.02 for 14 days, then aren't people after 42 days already seriously exposed to this?
So yes, let me clarify. Thank you for that question. And I'm sorry I presented it in a confusing manner. We have only measured levels at above the point, what's the acute 0.03 parts per million for less than 14 days. The first day that we measured it at that level was last Friday. So we are under that threshold. So what I was trying to explain is that we are still not at the time frame. We haven't passed the 14-day mark where that exposure level, that dose level would pass into a more chronic exposure risk. Prior to that time, the Bay Area Air Quality Management District had been doing measurements since they were first notified back on September 7th, and they did not reach that threshold as we understand in terms of when they notified us as the health department because of concerns about the levels that they started to encounter last Friday.
So Pete, I think you're next with your hand up.
All right, cool. Can you hear me?
We can.
Yeah, Pete Serrato's here with NBC Bay Area. So my first question, I got a couple of questions. The first one, I got a chance to speak to the plant the operator of the plant over there, and they said with what they're doing to clear this issue up, it could take them anywhere from 7 to 10 days. So is it safe to say from the county's perspective that this advisory will probably be in place for at least throughout next week?
Matt, do you want to take that one?
Sure. Thanks, Pete, for the question. I think the health department is looking at primarily two things in coordination or with respect to the health advisory that we have issued. And I'll speak to the first one, and maybe Dr. Sarah Levin can speak to the second one. The first is the county needs to have a level of comfort and reliability in talking to the operator that the plant is in a stable condition. Right now, we have been told the same information as you, that it's going to be about 7 to 10 days. They have 3 reactors there at the site that they're systematically going through and cleaning and bringing back online. And so that's the 7 to 10 day time frame that that CNH Sugar has been telling both, it sounds like, the media as well as the county. So we need to have a level of comfort with the stability of the operation of that plant. The plant, it sounds like, can be operated with fewer than 3 reactors operating. So what we're committed to is having daily operation updates from CNH Sugar. We are going to be communicating with them as to the status of the plant, the stability of their operation, and getting a good sense and feel of where they stand in terms of the operation of the wastewater treatment plant. Dr. Levin, do you want to speak to levels that maybe we would be monitoring in the community when you would feel comfortable lifting the advisory on that front?
Sure. Thanks, Matt. So the level of exposure and the duration of exposure really determines the health impact. And although the last couple of days it's been consistently going down in the right direction, which we are happy about, and it's not reaching that 0.03 parts per million, the days are going on. So I think we need to feel comfortable that it has gotten to a level of control in terms of the thresholds that take into consideration the length of exposure. So we won't feel comfortable with lifting the health advisory until both the operations are stabilized. And so we know that we can reliably and consistently over a period of days and weeks know that that threshold will not, in terms of dose level, will not be exceeded.
Okay, thank you both. Pete, I think you had, you said you had a follow-up question. So can you?
Yes, I have. Yeah,
okay.
just one more question. So, you know, when it's all said and done, we could be looking at what, more than a couple of months of, or I guess a month and a half to 2 months of exposure to this gas. Is there any data showing what some of the long-term impacts could be to this community that's dealing with this?
Matt, do you want to start there and then we'll see where we go?
Actually, Kim, I think that's probably better answered by Dr. Levin in terms of long-term health impacts.
Oh, okie dokie. Dr. Levin, you're up again.
So Pete, there's not great data on long-term health effects. There's just insufficient human data in terms of things like carcinogenicity, so risk for increased cancer formation. What we do know is that the chronic exposures over time can lead to effects upon the respiratory and the nervous system that can, what has been described in the literature is more exacerbations of underlying conditions, which is why there are groups who are more sensitive. The exposure in children seem to be similar to what you would find in adults. So there's not great data on that. And that's sort of the limitations of what we know. But yeah.
Thank you. So Kelly/Tom, I see your hand again, but we have a question in the chat that we'll get to, and then I'll come back to you. So give me just 1 minute. What are recommendations for families with regard to keeping windows open, managing high health risk individuals with asthma, respiratory, nervous system problems? So Dr. Levin.
Yes, so we are recommending that when it is at those levels exceeding the 0.03 parts per million, that in the location that you are, and as Matt said, you know, that's different throughout the community, and it's hard to use smell as the way to detect when it's dangerous. So in short, closing windows and doors can reduce your exposure, and using the indoors charcoal air filters is the best way to reduce the levels in the air.
Great, thank you. So Kelly/Tom, if you want to come back on. Nope. Okay, that hand went away. Let's see, we have one more. It looks like
All
we have
right,
one more.
so can you hear
Oh,
me now?
Yes, go ahead, Tom. Yes, thank you.
All right. It's my understanding, and Mr. Springer over at Hazmat in the county says that this is a low level of exposure. And when you read up on that, what it suggests is that low levels of exposure, the body absorbs this for a very short period of time, processes it through the liver, and excretes it in the urine. Is this really all that dangerous if that's the case? Because it doesn't seem to have any kind of aggregate effect unless you get into the very high numbers.
That's a great point, Tom. And I think it's important to recognize, like, our bodies produce hydrogen sulfide endogenously in our intestine on a regular basis at low levels. So we do have remarkable bodies that can process it. And so that's, you know, the accumulative effects are are really not well understood in terms of, how much can the body process. But I think that's why we're talking about the dose. There can be limitations to that. And then there's the cellular level of if there's exposure into sensitive cell types that are not able to clear it, that could cause toxic exposure. So I think those are the parameters that we're dealing with in terms of trying to measure the potential toxicity.
Thank you. Matt, we have a question about, is there a map that shows measured levels? Maybe you can talk a little bit about how we've been doing measuring and a map.
Sure. Yes, so we've been measuring hydrogen sulfide in the air, as I mentioned, since Friday, October 7th, when we issued the health advisory. We are using a 1 hour average at a single location as our data point. And that's more indicative of what a community member would be exposed to, as opposed to using sort of blips of either elevated levels or maybe even levels of zero. We want to get more of a cumulative reading of what somebody would be exposed to if they were in that location for 1 hour. In terms of a map, we certainly can provide one of the locations that we've been sampling at and the data, the 1 hour average data that we've been measuring at those locations.
We've been working on the map and trying to get it to reflect sort of the amount of work and the type of work that's been going on. So, we're doing repeated readings at the same locations over and over again, most specifically the middle school and the high school and that one intersection downtown. And so the map doesn't completely reflect the work that's being done, but certainly it will give you a sense of kind of where we're taking the readings. So we'll make that available on our website.
Kim, I should also mention that the Bay Area Air Quality Management District is taking air measurements as well. And so they may have data as well and a map that would show the levels that they've measured. Yeah.
So Matt, before you go away, sort of the last question I have so far, we'll kind of consider this the closing question unless somebody else, I see another hand, so we'll not consider this the closing, we'll consider it second to last. So what are your concerns here? What are you most concerned about? What are you really looking to have happen over the next couple of days and weeks as we continue to deal with this issue?
Thanks, Kim. I think from the health director's perspective, we have really two concerns. I think one that we've been asked a lot about is sort of the chronic exposure of hydrogen sulfide in this community. Obviously, we recognize that this has been going on for several weeks now. And so we are paying attention to sort of the cumulative timing that people have been exposed to hydrogen sulfide. And so we've been working aggressively with our health officer team here at the health department to really make sure that we're taking the chronic exposure into consideration, and as well as the acute exposure. I think the second thing that we're concerned about is the plant operation and getting stabilized such that we don't have an escalation of the incident, which is why the health department has really been having daily interactions with the plant and making it very clear to them our expectations of them getting the plant stabilized and back online and in operation such that they're not producing hydrogen sulfide that's being that this community is exposed to right now.
Dr. Levin, anything that you would like to add?
Sure. I think what I would just like to add in terms of those concerns and what we're most concerned about as well is the impact that this is having on the daily lives in the community at Crockett. One of the mothers that spoke last night said how she's not taking her kids to the park or the pool to play anymore because she doesn't want them to be outside exposed because they're getting irritated. And I think every day that goes on, what we do know is the long-term effects of kids not having regular activity or seniors not being able to do their regular mobility in the community is detrimental to the long-term health. So I think the sooner this situation is under control and the air is free of this gas and allows people to do the daily things that keep them well and healthy is what we are striving to reach.
Thank you. So George, I'm going to allow you to talk if you'll unmute yourself.
Perfect, thank you. So I have a question for Deputy Director Matthew S. Kaufman. Given this repeated incident, will the affected Crockett residents benefit from the Green and Healthy Homes retrofitting program? And if so, what is the timeline for the installation of commercial grade activated carbon filters?
Thanks, George, for the question. I'm not entirely sure about the new building codes in terms of the green and healthy homes. So I would have to sort of read up on what that is and if that would have an impact with respect to this incident.
Thank you. Yeah, that's not a health issue. So if you want to follow up with us, we'll try to refer you to the right place. Off the top of my head, I would think it would be the Community Development Department here at the county, but we can help you figure that out. So did you have another follow-up?
Yeah, I was just curious because I know it is a health services issue, given that Anna Roth just pushed this on item C24 on the Tuesday's boards of supervisors.
Issue, yes, but program, no, it's not our program. So we'll help you. So if you'll follow up with on our media line, we'll help get you the details that you need there, George.
Got it. Thank you.
Yeah. Okay, it looks like those are all the questions. I'll put one last call out. Anything else that that anybody wants to ask? Okay, well, I want to thank, Pete, one more. Go ahead.
Just to confirm, the advisories through the weekend, correct?
Yes, so yes, that's a great question. We will not update the advisory unless the monitoring that we're doing in the community indicates a need to do so. So our teams will stay out in the community throughout the course of the weekend and monitor the levels out there. But we won't report to the community unless there is a need to do so. So yes, it will stand for now. So so thank you for that reminder. And then we'll be back with another advisory as necessary on Monday around midday. So okay, thank you all.